For the past year, we've been talking about the mental health effects of the pandemic. Now, the largest study to date addressing this issue has just been published, and we asked our 9 Health expert, Dr. Payal Kohli, for her take on it. Good morning, Dr. Kohli.
Hi, good morning, Corey. Such an important topic we're talking about today.
It really is. So what are the highlights of the study?
So this is the largest study, as you just said, to date. And essentially what they did is they took greater than 230,000 hospital charts and medical charts in general, combed through them, and what they found is that 1 out of 3 people who had COVID infection had a neurological or a psychiatric diagnosis that was new within 6 months of their infection. And the most common of this, not surprisingly, was anxiety, but there was also mood disorders, substance abuse disorders, insomnia, and such. And interestingly, for 13% of the people, this was the first time that they were having a neurological or psychiatric diagnosis. So that's more than 1 in 3 Americans that are being diagnosed with a mental health condition for the first time as a result of their COVID infection.
Gosh, I know so many people who this definitely applies to. Who appeared to be the greatest risk?
Yeah, this was interesting. So, not unexpectedly, those that got the sickest with COVID appeared to have the greatest risk of having some sort of a complication. So really those that ended up in the hospital, those that were in the intensive care unit. And what was interesting was that it skewed more towards the neurological stuff for those that ended up in the hospital. So we're talking about conditions like stroke, brain hemorrhage, dementia, those types of problems in those that were in the hospital, as opposed to more of the psychiatric problems for those that were outpatients. And we're talking about small numbers for actual neurological conditions, but when you start to apply it to millions of Americans that have gotten sick from COVID, it really does make quite a significant impact on our population.
How do these mental health effects of COVID compare to those with like the flu or other illnesses?
That's a great question. So what the authors of the study did is they said, well, is this just a function of being sick in general? It has nothing to do with COVID specifically. So if you're sick with the flu or sick with a cold, are you going to have similar types of conditions? And so they looked at the incidence in those populations, and it was much higher. So 44% higher compared with the flu, and 16% higher compared with other respiratory illnesses. So something specific about COVID appears to be associated with a higher risk of these psychiatric or neurological conditions, specifically the ones that we've discussed.
Dr. Kohli, what's your takeaway?
I have to say, Corey, that my biggest fear is what we're looking at right now, which is that we've done a really nice job of flattening the curve over the last year. As we all get vaccinated, we've really decreased the number of people dying, and the number of deaths have gone down substantially in our country. But we're now looking at the mental health curve, which I think is going to play itself out over the next several years. And our job now is to flatten this mental health curve. This study has given us a little bit of insight into just how steep that mountain ahead of us is going to be and how much work we have to do to flatten it. So I would say a couple of key things. The first is get the vaccine. So if you haven't had COVID, get the vaccine, because the last thing you want to do is to add, mental health disorder or neurological disorder onto your plate. And the second is, if you've had COVID or you have a family member who has, make sure you reach out to those COVID survivors and check in on them, because we only caught a small piece of the pie with this study. We only got the patients that actually sought care in medical facilities. There are many more silent sufferers out there. So reach out to them and make sure that they're getting connected with mental health resources if they happen to need them.
Yeah, it's so important to check in on those around you. Dr. Kohli, really appreciate you joining us this morning.